Let's Talk Mental Health podcast is sponsored by Torrance House Interiors East Kilbride. Concept by you, designed and managed by us. Bespoke luxury kitchens, bathrooms and room interiors. Contact us at info@torrancehouseinteriors.com or phone 07400 600 556.
Good evening and welcome to the Let's Talk Mental Health podcast, your weekly podcast where we lift the stigma associated with mental health. I'm your host, James Downey, founder of the TAD Project East Kilbride, an online private and confidential hub which provides a place for individuals with poor mental health to strive and build autonomy and confidence in members. We provide resources including health walks, boot camps and phone volunteers to help with everybody in their time of need.
I'm Brooke Longmore. I'm a mindset and mental health specialist with 16 years experience of studying the human mind and working with the human mind. I specialise in helping people move beyond emotional discomfort, emotional distress towards mental and emotional fitness.
Tonight, we're delighted to be joined by Communications Manager of CME Scotland, Nick Jarodowski. How are you, mate?
Yeah, I'm good, thank you. How are you guys?
Fantastic over here. Brooke,
I'm
how
good.
are you?
I'm very good, thank you.
So, Nick, welcome to Let's Talk Mental Health. And, again, this is a place where we really lift the stigma with mental health and, big things happening over at CME Scotland. Can you tell the viewers and for the people that are going to listen later on a little bit about yourselves, please?
Yeah, so I have been at CME for about 6.5 years now, working in the comms team the whole time and been working as the communications manager for about the last 3.5 years. So at CME, I lead on all of our campaign work, our media work, working with our media volunteers, which is a group of amazing people who we train them to share their own experiences of what it's like to struggle with their mental health and experience stigma and discrimination, to try and make a difference to help others and to get their story out there. And CME itself, for anyone who doesn't know who we are, it's the national programme to end mental health stigma and discrimination. It's been going since 2002. For the first 10 years, it was a campaign really aimed at raising awareness of mental health. And then since 2013, we've been a behaviour change programme. So we've still done big campaigns, but we also work in schools, in workplaces and in health and social care as well, and have a huge social movement of volunteers and partners who work with us too.
Yeah, could you tell us about the kind of work you do in the schools and stuff like that? Because it would be really interesting to know,
Yeah, so we have a pack called What's on Your Mind. This was developed with about 20 young people who, again, all had the experience of struggling with mental health themselves and experienced the stigma and discrimination. Everything that CME does really is led by people with that lived experience. So they worked with us and our education team to develop this pack, which is sort of split up into like 45-minute sessions, so it can be done within lesson time. And it's all about teaching young people and actually the teachers as well and everyone who works in the school about mental health. It helps to give them a common language to speak about it because, as I'm sure we all know, speaking about it is a really difficult thing. So it tries to create a common language and give ideas on how to tackle stigma and discrimination. So we have that. We've also been doing mental health first aid training with pupils, 6-year pupils and teachers as well. And that training, again, it's all led by our youth champions and by young people. We've done that in schools all across the borders, North Ayrshire and Lanarkshire as well as a few different pilot schools across the country too.
Yeah, Lanarkshire is where I'm from, you know. And that's great, you know. And you're really working to change negative behaviour, aren't you, at CME Scotland, you know, with regards to mental health. Can you tell us a bit about that?
Yeah, I mean, it's what CME is all about. So we do it in the three key areas that I mentioned earlier of workplaces, education and young people, and health and social care. And within each of these areas, we have kind of programs of work. So in work, we have a program called CME in Work, and we have, I think, sort of going through different stages, nearly 100 employers across Scotland who are then working with us to change their policies and change their practices, and improve their cultures so people aren't experiencing stigma and discrimination. So some common issues in places like that could be someone not getting a job because they've struggled with their mental health. It could be that reasonable adjustments aren't made to help them. It could be that after struggling and disclosing that, they might be given less responsibilities, treated differently, or even demoted. It's not always done as explicitly, because obviously you can't discriminate against someone within the law, but there are still ways around it. Unfortunately, we see that happen. And then in health and social care, we're doing a lot to work with the people who work in those areas, really, to train them. We've just released a whole new set of training resources, some videos which have mental health professionals and people with experience of using mental health services on what the stigma and discrimination feels like for them. And there's a sort of days training resource you can download. There's stuff on how to change your policies. Try and create everything so people can just take stuff from us and hopefully run with it themselves. Because CME, we're a national program, but we're a team of 14 people, so we're not huge to cover the whole of Scotland. So we really have to try and make sure that everything we do has the biggest impact. So we also have loads of national campaigns. Some of the big ones we have, the first Thursday in every February is Time to Talk Day. And we do that with Time to Change down in England, Time to Change Wales, Change Your Mind in Northern Ireland, and See Change in Ireland. And that's the only point throughout the year where all of and there are kind of our anti-stigma partners, where all of the anti-stigma programs across the UK and Ireland kind of work as one to get everyone talking about mental health. We also had a campaign in workplaces called Power of OK. We created an emoji-powered jukebox for young people to help them to talk about mental health. So quite a few different methods that we use, really.
Lots of good work there. Yeah, well, I've been writing questions. I've got loads. What I want to go back to is the work that you do in the education system. So I've been working in the education system for the past 15, 16 years with young people. Around very much similar topics, all about mindset, mental health, building resilience, raising confidence. So I'm just interested to hear a wee bit about how that goes when you, like, what's the experience of getting in and working with the young people from your end?
From our end, it's always a really positive experience, and we find that young people are really keen to learn. And I think what makes it work so well is because when we go in, it's not kind of our core staff team that are going in and doing the training, or who are working with young people or facilitating the conversations. It is our youth champions or some of our youth workers. So it's other young people. It's that kind of peer-to-peer thing, because we know that, like, as a staff team that's pretty much like in our 30s or above, like if we go into schools and we're speaking to 16-year-olds, they don't think we can't relate. Like, and they know that we can't relate because what they are experiencing right now as young people is totally different to what most of us experience. So it's really important for us that it is other young people delivering that, who also have experience of struggling with their mental health. They don't necessarily talk about that in the training or say it, but having that experience, that personal experience, brings a real kind of authenticity, I guess, to the training. And yeah, we find that the young people are always really receptive to it. Sometimes the slightly harder job is then really working with the teachers as well, because I think it's a difficult balance, because we need to, when we work in schools, we try and take a whole school approach. So as well as doing everything with the young people and trying to help them and upskill them, we also want to do our workplace program within the schools as well. So there is actually something there for teachers. So teachers don't just feel like it's another thing that the young people get taught. We are actually trying to make their workplace better for them, like we do when we're going into any other workplace. So hopefully when CME's been in and we've been working with a school, everyone within that, teachers, pupils, admin staff, janitors, whoever it may be, all have got a better understanding, because everyone who's in that community, I guess, is really important.
Yeah, and that's very similar to what I do as well. So I do work with the young people and I work with the staff, because that's really, really important, isn't it? I remember when I first started working in children and families a number of years ago, the project that I worked for very much just worked with the young person. So we were taking the young person out the family home, doing all this fantastic work, and then taking them home. And then we started realising this isn't working. We need to involve the parents. We need to involve the full family. And it's very much like that in the education system. So I very much mirror what you guys are doing, involving the staff as well, because I think we have to not only educate the staff in terms of what the young people are experiencing, but also support the staff as well, because the staff are just this part. It's a community, isn't it? The education system is a community, and we need to support the staff. What I have also done in some inputs as well, as depending on what the schools decided, but I've also involved the parents as well, and that has worked really well. I remember in particular, I was working with a group of fourth year pupils, and we had an evening where their parents came along. And that was interesting. Fourth years sitting with their parents. And they'd been working with me for about 5 weeks, and then we invited the parents along. And it was really good, because when they came into it, what I was doing is working with them as individuals, not families. So it was almost like, leave your mum and dad role at the door, let's come in as people. And the young people really got to see their parents as people, as opposed to mum and dad. So there was a lot of fun there. So I completely agree with the work that you're doing. It's absolutely fantastic. Another wee question just before we move on is, what I'm asked quite a lot is, I used to work for a project that we had a lot of volunteers. I didn't have much to do with the volunteers because we had a volunteer coordinator. I had my whole other caseload. But how do you keep volunteers motivated? Because that's what a lot of organisations bring me in to ask that question and to do some work with their volunteers. So how do you guys keep your volunteers motivated?
I mean, it's been difficult this year with the way everything's been, to try and find ways to keep volunteers motivated. In general, I think it's a mix of things, and it's providing them with the opportunity they thought they were signing up to, actually making sure that they can do it. It's when someone starts training with us, when they come on board, whether they're a young person working in schools, or they're one of our media volunteers, or one of our community champions, they kind of know exactly what the role is and the expectations when they come in. So with something like the youth champions, they'll know they're going to be in schools, and it might be quite intense for a few weeks, then it might be quieter for a little bit. With the media volunteers who share their stories in the media, they know that it's quite a sporadic volunteer opportunity. So it kind of depends when we get calls from the media as to then when they will have stuff to do, or when we're doing big proactive promotion things. So it's really setting those expectations at the beginning, so people just know exactly what they're signing up for, and they don't feel like they've agreed to something and it's not what they wanted. And I think it's really important for us that our volunteers also feel like they're part of something together. They're not just kind of individual people volunteering, whatever their role is. And we've not always done that brilliantly. We've not always had kind of our youth champions and our community champions and our speakers and our media volunteers feeling like one group together. Sometimes just the nature of the way our team was, that everyone had a different role looking after a different group. So they didn't necessarily feel like they worked together so much. And we found that actually that wasn't a great way to go about it. So actually having everyone feel like they're part of something is really important. And also getting like validation for what they're doing, which like the people who share their stories, our volunteers get that when we put it out on social media and the media. They get loads of amazing feedback, which can actually show them they are really making a difference and they're doing something. It's the same for our volunteers in schools, our champions, and we've got a huge role in really continuously showing them the amazing work they're doing, that they are actually making a difference. And then I suppose also knowing when volunteers have kind of had enough, but you know, they feel like they've got out of it what they want to get out of it. and not desperately trying to cling on to people and be like, no, don't leave us. Because
oh no, there's probably some good ones you're like, don't go. Stay with us.
And you want everyone who's motivated and wants to make a change, you want them all to stay, but you've got to kind of recognise as well when it's right for people to then move on and do something else in their life.
Absolutely. Volunteers a lot of the time come on, as you say, to fulfil a role, and they outgrow the role as well, don't they? And it is about, if you love them enough, set them free.
Yeah, and some of our champions, our community champions especially, have gone on to do amazing things. Like one of our champions a few years back went on to set up a charity called Brothers in Arms, a sort of men's mental health charity that are doing amazing work now. And another couple of them, one of them set up called Martin's Monday Club through in Oban, which is kind of talking clubs originally for men, now for men and women. Another one, Gary, has started a club as well and is also doing stuff in his workplace. So it's kind of trying to inspire people and just to give them the tools they need to fulfill, I guess, it sounds cheesy, doesn't it? But to fulfill their own destiny or whatever. But to be able to give them everything they need to go on and do what they want.
Absolutely. Sorry, James. Sorry.
No, it's all right. It's amazing the impact it can have for volunteers to, then go on and, do their own thing, whether it be their own project. And touching on what we were speaking about a minute ago, at schools and stuff like that, for somebody that's, had poor mental health, I felt when I was at school there wasn't enough. So it's great that the next generation coming up that are kind of experiencing that in schools now. It's really, really empowering, I think, it's fantastic.
Well, that's important. That's very, very funny you say that, because just a wee second ago, I was just about to say the word that I wrote down when you were speaking, Nick, was very much about empowerment.
Yeah.
That's what I felt like. A lot of what you're doing is very empowering. And also, as you say, bringing the volunteers on to lift them up and almost kind of push them forward to what they want to do. And it sounds like a lot of them. James, maybe that's some guests for the show as well.
Yeah, we're willing to have any volunteer on here, and that's what it's about for me, because, I do a lot of volunteering now myself, I never used to, but I feel as if I need to do it. It kind of fills a hole within me, because, I feel at times with my mental health, you start to get lazy at times, but it's great that you can have projects and go out and volunteer, especially, to do with mental health and whoever else is out there. But it's fantastic. You are doing great work, Nick, and again, you are really big in human rights as well. So can we touch on that, because, we want people to feel respected, in the workplace and wherever else they go when they're dealing with mental health. So can we touch on that?
Definitely. I think human rights is always a tricky one. I think even people just hearing the term, it doesn't put them off as such, but I think it feels quite an overwhelming subject. Although a lot of it is just the basic things that all of us have, kind of hopefully have our rights respected on a day-to-day basis without us really needing to know that they are. But then trying to help people get their rights supported. We created something a few years ago in partnership with the Scottish Recovery Network and Vox, which is the Voices of Experience, something called the Rights for Life Declaration. And we worked with hundreds of people across Scotland to create a declaration of rights on what people thought were the most important to them to be able to live fulfilled lives, which is CME's ultimate aim, is to help people who struggle with their mental health to be able to live fulfilled lives. And kind of, I suppose, within that, acknowledging that recovery as well isn't like a kind of linear sort of to an end point. It's
Absolutely.
Up and down, and it may not ever be like an end point. It's just kind of living a fulfilled life in a way that you can enjoy. And discrimination, obviously, is a huge rights issue, and without tackling stigma and discrimination, we can't really ever reach. I don't think anyone could reach that place of recovery or anything like that, because I suppose for us, tackling stigma is key to everything in mental health. Initiatives for well-being and stuff are really, really important, but unless there are cultures where stigma doesn't exist underneath it, then it's hard to actually do things that can help your own well-being. And it comes into everything, like right at the start, if someone is struggling for the first time with their mental health and they are kind of worried to tell anyone because they're kind of ashamed or embarrassed, they're not sure how people are going to react. That's the result of stigma and discrimination. That fear comes, it's a legitimate fear because they've seen other people get treated differently or unfairly because of it, or they've heard or seen in the media the way mental health can be portrayed. Stigma is also someone, like I mentioned earlier, in workplaces might lose their job because their boss doesn't understand the diagnosis of schizophrenia, and they just think, oh no, I can't have someone with that diagnosis here, and that happens and people lose their job. It's young people experiencing depression for the first time, telling a teacher, a parent, a friend, and being told, oh, it's just a phase, you'll grow out of it, it's hormones, whatever, and not taken seriously. It's someone going to A&E who may have experienced self-harm and being made to kind of almost feel like they're a secondary patient, and oh, well, you've done this to yourself, you need to look after other people first. And again, this happens, and in all these areas, like if stigma and discrimination isn't tackled, if these behaviours aren't changed, and they are changing, there's a lot of improvements, but people are never going to get that chance to live a fulfilled life. And it's more than just raising awareness and changing attitudes. And a lot of people do say that mental health, and it is spoken about a whole lot more these days than it ever has been before, and that's great. But that's really only part of it, because if someone's aware of mental health, like, oh no, yeah, that's an important thing, but then they go in and they're a boss, and then someone takes 10 weeks off work or whatever because they really struggle with their mental health, and they're like, well, you just can't have that, and then that person loses their job or something, then it doesn't really matter if people are aware of mental health. It's the behaviours that go along with it that still really need work, and that all comes into rights and people having their rights listened to.
Yeah, and I think what I kept thinking of there was, you know, in the workplace when people are not being maybe treated fairly, when they are facing mental health challenges, what I'm finding a lot of the time is when I'm working with organisations is that the people who are in the leadership positions don't really know how to deal with it. So we're maybe quick to jump to say, they're not getting that right, or it just feels like mental health policies a tick box. But what I speak to organisations about is we have to support those in leadership positions to feel comfortable, because if, as you say, if somebody comes to somebody in leadership and says, well, I've been diagnosed as schizophrenic, and they have this media perception of schizophrenia, they're not educated, they don't really understand it, the first thing that kicks in is fear. And when fear kicks in, a lot of people back off and go, whoa, I don't know how to deal with this. And then that's felt as though, well, I'm not being supported. So I think it's really important that people like ourselves and you are always educating people on what it means and how to support it. We have to support those that are supporting.
Yeah, you're spot on. Totally. We know from what we've done, and we've seen that unless you have senior management buy-in, nothing in a workplace will never quite get done. You need that, and we have that as part of our workplace program for people to be able to sign on to it. Yeah. Like, there's lots of people in lots of workplaces who want to make a difference, but to join into the workplace program, you need to have sign-off of senior management, because otherwise it's going to hit a block and it's not going to go anywhere. Yeah, but
I think what we need to remember as well is people that are in senior management and leadership positions are human beings. So they might be facing their own challenges too. So if you've got mental health challenges, somebody comes to you with mental health challenges, then they could be opening up a lot of wins for you as well. So we have to remember that these are people. And I think that's, as you're saying, where sometimes organisations get it wrong, they say it's like the schools, we'll provide all this for the pupils, but don't just forget the staff. We need everybody in the whole workplace, education. We need to support everybody with that.
I totally agree. And see, my last job, I actually left because of mental health issues, and I felt that when I was in the workplace and I was suffering, I went to my manager, I'd spoke to him, and I'd said, look, you know, I'm really bad, I'm suffering from anxiety and depression. And he says, well, you need to take time off, James. And I was like, you know, I was waiting for a different reply, you know, and I felt as if they didn't have that education and knowledge to, you know, maybe sit me down and talk about mental health in the workplace. And I felt bad, you know, I felt really, really bad in a way.
And it obviously might have felt to you, it was almost like that was a kind of like, oh, just I can't deal with this, just you go.
Yeah.
And for you being on the receiving end of that's horrendous. But I think sometimes we're quick to jump to, that's horrendous for you and you need to work through that, of course. But sometimes we're quick to jump to, well, workplaces aren't really supporting it, but sometimes they don't know how.
Yeah, exactly.
And there's this fear around mental health of getting it wrong as well, isn't there? So again, a lot of people go, well, I'm not going to touch that. I'm not going to go near that because in case I get it wrong and then my name's in the paper.
Even some sort of a care package, that when you come back to work, that, there's things in place.
Yeah.
But I mean,
what would have, what do you think would have helped in that situation, James? Like, what could they have done that would have helped?
Well, put things in place that would help me in the long run, because obviously I was in medication and stuff like that as well, so I was hiding a lot of stuff, but at the same time, I was working through it. However, when I went in and I'd said, look, take time off, James, that's all that was said to me. There was nothing saying why are you feeling like this. We'll put this in care for you when you come back. We'll be able to do this and do that for you. So I feel, in the workplace, there needs to be a lot more done. And sometimes it's hard for guys to speak out in the workplace, Yeah,
and I think you're absolutely spot on. And James, what concerns me is, right, and again, not blaming anybody for this, but what concerns me is, what if you had been somebody that was so close to maybe suicide?
Yeah.
And that was your way of saying, I need support without actually, that concerns me. That could have been a bigger cry for help from people.
Yeah.
People might be doing that.
Yeah.
And then if it's just this response, and again, it's not blaming the person for doing that.
No.
We have to respect that wasn't nice for you. It was probably very uncomfortable. You're looking for more, but it might have been that person just didn't know how to deal with it, and that's where the education comes into it. But what about people that are being turned away because lack of understanding, and then they've got nobody else to turn to, and that might have been the only time they were going to reach out, and then the results of that could be devastating.
Totally agree. So let's move on to the next. Sorry, on you go, Nick. On you go.
No, I was just saying what you said, Brooke, about people kind of having a fear about speaking about mental health or saying the wrong thing is totally true. And there's I think so many conversations that could really help someone that don't happen because someone's just like, I don't want to say the wrong thing and make it worse. Or they're worried to ask, like, how are you doing? Are you okay? Because then I think people still think that, well, if I ask that and they're not okay, then I've got to sort it out or help or support in some way, and it scares people. But in that same way, that like just listening and showing you care and just being a human about it makes a huge difference to someone. And you don't have to then be you're not responsible for that person's entire health and their entire journey. The same way, if someone was really unwell at work with a cold or something, when people could go into work and be unwell with colds, you'd still ask them how they were, but then you wouldn't take on responsibility of giving them Lemsip every 4 hours. Like, it's the same thing, but being kind still makes the difference, and still it doesn't fix it, but it can make someone, it can help.
Yeah, absolutely.
Totally agree. So, Nick, can you tell us a wee bit about your role within CME, what you do as a communications manager, kind of out in the field and stuff like that?
Yeah, I mean, not much out in the field anymore. I spend most of the time in my dining room, but one day. But yeah, so in my role as communications manager, I have, I guess, a few key things that I do. Probably the most important and my favourite part of my job is working with our media volunteers, and it's training people who've experienced mental health problems, who've experienced stigma and discrimination, and working with them and training them so they feel confident to share their story in the national media, in the local media, on social media, on our website, wherever it may be, and speaking about really important issues and using their stories to change behaviours. And that, I find, it's a really rewarding thing. And before I worked at CME, I was a journalist. So I was telling people stories as well, but I was more telling people stories that, let's be honest, they didn't really want me to tell, and I didn't really feel comfortable telling them, which is why I'm not a journalist anymore. But this is like, it's really great to actually see people who maybe they're a bit unsure, they're a bit shy about sharing their story, about what to say, but they want to make a difference. And actually working with someone over a few years and seeing how much they can grow and the impact they can have, and then just how confident they are to then kind of speak to anyone about how they're feeling, because they know they can do it in a way that's safe for them, that's safe for other people, that's not going to be triggering, and is going to make an impact. So that's a huge part of my job that I really love. Aside from that, I lead on all of our campaigns. So I mentioned a few of them earlier. The next one coming up being Time to Talk Day in February, which actually I put a load of stuff on our website today. So anyone who wants to get involved in that in 2021, all the resources are up for downloading now. So I lead on all of our campaign work, which again is totally varied. So I think I touched on a little bit about our Fields FM campaign, and that was one of the most kind of interesting and different campaigns we've worked on. We started off working with our youth champions, and we surveyed about 1,500 young people across Scotland to ask them all about ask them generally about mental health was like for them. We were doing it as part of Year of Young People in 2018, and working, the Scottish Government had asked us, basically they gave us this really broad brief. They said, we'd like you to get young people talking about mental health, and by young people we mean anyone between 8 and 26. So it was like this huge brief, and I mean, I am neither 8 nor 26, but I certainly wouldn't put those two people in the same bracket. They've got very different interests. I'm pretty sure a 26-year-old could be the parent of an 8-year-old. So it's having to be really broad in what we were trying to do. So we did a huge survey of young people, and they kind of came back saying that I think it was about 37% or something. Yeah, it was about 70% or something. It was the other way around. Like 70% said they wouldn't tell anyone if they were struggling to cope, compared to it was much less like if people were struggling with their physical health, they're way more willing to speak about it. So we thought with the conversation that we should really be having is asking them why they can't speak about it, what makes it difficult to speak about how they're feeling, what makes it easy. And we worked with an amazing creative agency called Studio Something to create something. And we also asked them about coping mechanisms and how young people coped. And music came right up near the top. It was third behind spending time alone and cry, which are important coping mechanisms, but not catchy campaigns really. So we thought we'd kind of go down the music avenue, and created this, and also that was kind of had appeal across the spectrum. So we created this online digital emoji powered jukebox where young people could select an emoji based on how they're feeling, and then it would load a playlist up. Whilst that was loading, it would ask them questions about what makes it difficult to speak about how you're feeling, what makes it easier, what can help to challenge stigma and discrimination for young people. Although we didn't use the term stigma and discrimination, because it didn't really resonate particularly with the younger age group, so kind of what stops people from being treated unfairly. And we got about 5,000 young people engaging with the platform. It creates a playlist on Spotify, which you can save to your Spotify. And we got amazing response from young people, which then led to the government putting in some actions to ensure that stigma and discrimination was considered as core whenever they're doing anything on mental health with young people. So actually the young people had this huge influence in what the campaign was and what the government was doing. So leading on campaigns, our job, sorry, I'm not sure what I cut out there. But another big part of my job. I also lead on all of our media work. So whenever we're doing any press releases, we're speaking to the media. I'll either be briefing our director or doing the media interviews myself, doing stuff like this with you guys today. Pretty much we've got a whole team of really smart people who do all the work, and then my job is just to tell everyone they've done it.
Yeah, and like you said there, 70% is a really big margin, isn't it, for people, and we were kind of touching on music last week, weren't we, Brooke?
We were. I was just thinking about that there, yeah.
And, emotions and stuff like that. And obviously, watching what you listen to at times and stuff like that, wasn't it, Brooke? It was great.
Yeah, absolutely. And I think for the young people, I think that's really interesting that they've got that something that they can use, something so positive, because music can be very, very positive for lifting mood, especially for young people that have got their earphones in 24/7. right? It's like, what better way to help them than that? But yeah, that figure's quite scary, actually, isn't it? That how many people feel that they weren't able to speak out.
Yeah, it was. It was from stuff we'd done previously. It wasn't hugely surprising, but it was.
Yeah.
It's something that clearly needs more work done.
Absolutely.
And yeah, it kind of mirrors similar to what we've done when we've spoken to adults as well. I think the actual thing was something like, I'm trying to remember what it was off the top of my head before, but I think it was actually the other way around. It was like 36% or 7% said they would tell someone if they're struggling to cope, compared to about 70% who would tell someone if they were physically unwell. So like the disparity, it's kind of the other way around, but the disparity is the same.
Was it more so men? Would you say that, you know?
The survey was actually, there was more girls than there were boys who answered the survey. So,
well, I think that's a big thing in itself, isn't it? That it's more females that answer, so men aren't even getting to it.
Yeah.
I mean, what I would just add here is, seeing the last 2 weeks, I have had a number of men sign up for my programs, which has been totally refreshing, because James, we've been touching that really every week, haven't we, about men's mental health. And when I work for organisations, a lot of the time, predominantly, it's always been more females that I've worked with, but there would be men that would be involved because dads would get involved and they would kind of have to. So they would be a referral one to us. They would be out. I'd be out at the house, and it was a kind of case of, oh, there's Brooke, need to listen to her. But I've seen a huge increase in the last 2 weeks, actually, of men that's come to me and signed up for programs, which is dead refreshing, because I think maybe it's what we're going through just now, but that's refreshing for me to see that men are actually getting to the point where they are reaching out. And I don't know if it's been what we've been discussing on this, or I don't know if it's just a sign of the times just now, but certainly in my 4 years of working for myself now, that's a huge increase that I've seen.
Yeah, and I'm trying to get more men on my hub. Sorry, Nick. Like I said, I'm trying to get more men, obviously, in my TAD project hub, you know, because I did feel that there was a lot of women out there. But I have, in the last few days, like, the numbers have risen so much, because obviously we're getting into lockdown now, you know.
Yeah, people want to be involved.
Yeah, absolutely. What were you saying there, Nick? Because I know you were going to kind of touch on something there.
No, I was just going to, I thought it was interesting what you were saying, Brooke, about having more men sign up, and perhaps it is you guys doing this. Like, they're kind of a lot, I'm sure you guys know as well, and have seen and touched on, that men don't always want to speak about it, but they don't want to be the person that opens up the conversation. They don't want to be the person that instigates it. And perhaps just you guys doing this is actually, it's almost like you've instigated a conversation. They've seen that they can talk, so they're like, well, okay, fair enough. You know what? Maybe I can talk. And what you guys are doing with this, it's really positive. It's a really great thing. And again, it's just another avenue where people can talk about mental health. They can see what's like what other people think, and it kind of does give that openness.
Absolutely. I've been doing videos across my social media now for about 4 years. So I couldn't do videos when I was working for an organisation, because you were very much bound by a lot of policies, procedures. You had to really watch your social media use. And now, obviously, in the 4 years I've been working for myself, I've been doing videos. What I tend to find is, as well, when people come forward, a lot of the people that come forward, I don't know their name. They've never, you know, you get the typical people you see all the time that will like and comment. But a lot of the people that end up coming forward will say to me, look, I've been watching you for 2 or 3 years, and this is just when I felt like I wanted to reach out. I don't know their name, so they've never liked anything, they've never commented, but they watch it for a long time before, and I guess it's building that trust. And I think certainly in the mental health field, we've seen an increase in the last couple of years of so many people out there talking about mental health, which is great. But I think people are finding it hard to know who to go to as well now. Yeah. Because there's so many. It seemed like for a while the term life coach seemed to be the glamorous go-to of people that didn't really know what to do, that would just go, well, I think I'll just become a life coach. And that was confusing a lot of people as well. And a lot of people will come into this and they'll be in it for the right reasons, but other people were in it maybe not for the right reasons, which a lot of those people have maybe went onto a different path. But certainly what I'm finding for a lot of clients that come on my programs is that they've had to watch me for a while, and it's almost like, oh, she's still there. She's still talking. She must have something to say, so I'll go and speak to her. But I do think in the mental health, we always need to just watch. I suppose our mindset in mental health is precious, isn't it? And we just have to be cautious of who we give that key to the mind to as well.
And we're so plugged in now, Nick, you know, and you guys are doing a job. You are going to schools, you are going to, you know, and it's great to be so plugged in for this generation of, you know, kids coming up that will be able to see platforms like this, you know, charities, endless projects that are happening. There's so much available now, you know.
There is a lot available, yeah, and I think having that variety and having community-based stuff is really, really important. And I guess something where it's always difficult for us, I think, and we're not aware of it. A lot of CME's messaging and around things like Time to Talk Day is like, have a conversation about mental health. And we always tell people, if you're struggling, don't struggle alone, speak to someone, ask for help. It's really important that you don't just bottle it all up. But the reality is, especially like people try and get help, a lot of, say, like mental health services, especially right now with the pandemic, are so stretched. And people sometimes reach out for help and then they don't get the help they need, or they get dismissed when they go for help, or they don't get the reaction that would have been helpful. And that's why for us, like, it's really important that all of us are supportive of each other, and kind of so it's not entirely just the services that are going to support people. There needs to be more services there to support people, but yeah, there's a sort of what ideally we want to change the whole culture around mental health. So it is that kind of early intervention when people first start struggling. There's someone there they can chat to, whether it's a friend, a family member, a teacher, a manager, whoever it might be. So it doesn't get to the point where someone is in crisis and needs help and support from services, which then might not be there. But it's a really difficult one, and we're always aware of it when we're telling people to speak and reach out and ask for help. And then if there's not the help for them, it's a really difficult situation.
Absolutely, and I think as well, a lot of people that reach out and then are told, well, it'll be a 6 to 8 months waiting list. It's not really what you want to be hearing when you're really, really struggling and you've built up the courage to reach out, and then there's not that support there as well.
Yeah, totally agree. And you know, the word that you said there, Nick, togetherness, and this is what this is about. We're all in it together. We're in it for the good of mental health, and we all should be helping each other. You know, from small community organisations to charities to, you know, amazing places like CME. You know, shouldn't we? We should all be in this together and share the knowledge and share the love. That's what I believe. You know.
Yeah, I agree with that. I think so. What obviously you guys are both really passionate about this and doing this. What made you then want to start doing the podcast and sharing it more?
Brooke, do you want to? I mean, we met, and you know, obviously, we've got a blend of obviously lived life of poor mental health, Nick, and obviously we've got Brooke's professional, you know, opinion, and we thought that, you know, we could touch on subjects, and again, like yourselves, end discrimination and less stigma, you know, and speak about what's really going on, have people on in real time, talking about real subjects, and you know, it's great to have this platform. Yeah,
absolutely. James and I was introduced through someone, but almost it feels like it was so meant to be, because the minute we started speaking, it was very much like, whoa, right, okay, you're passionate. And I was saying to James yesterday, I think it was, that I've been approached by many people to collaborate, and I always felt like, this isn't the right time, or maybe we've not got the same kind of ideas. But when James and I started speaking, it was very much like, right, this is what we're supposed to be doing. And what we quite like is the fact that we do have that blend of the lived experience stroke professional side, because nobody really wants to listen to one side all the time. So having both sides interacting is very useful, but also having that male-female as well, as opposed to just being 2 males or 2 females. So again, reaching different audiences and just speaking on a weekly basis, to have people, we've had a lot of really, really good feedback of people that are tuning in weekly and are taking a lot away from it. And I think, obviously, I'm a private business, so people do need to pay for my services. But I always like to always offer a certain level of content that people that maybe aren't ready to pay or can't invest in the services can access as well. Hence why we do this, to ensure that people have information that's coming to them on a regular basis. Again, doing it at the same time every single week. People know we're here. And it's just about having that conversation and allowing people to join in the conversation as well.
Right.
And having a bit of humour as well. We've had a few laughs because we've got to add some humour to the subject sometimes.
Indeed we do. And that's it. We're just, again, we've not got all the answers, Nick, but we just want to kind of lift the stigma and show people that we can talk about mental health in this sort of way, in real time.
And I think we don't have all the answers. I don't think anybody's all the answers, but I think what's great about this is us having different guests on every week. So sometimes we'll have professional guests, sometimes we'll have guests that want to come on and share their story. And again, I think we're getting a lot of answers to a lot of people by bringing so many of us together. I do genuinely believe everybody who's in this, in their heart's in the right place when it comes to working with mental health. There's a place for us all, and I think we are getting across a very good message every week by having different guests on. We have it's the same themes, isn't it, that run through the conversations every week, but the messages that are coming across are slightly different because it's different people with different points of view. And for us, it's just really exciting. We've got a lot of big plans as well, big plans. So it's really exciting.
It's good to reinforce as well, isn't it? To kind of, as you say, like, to have it being consistent and week after week, and because we know from when we use different ways that CME's operated over the years, and used to do a lot of kind of, say, someone would ask us if one of our volunteer speakers could go in and do a talk, and then we'd say yes, we'd try that do, but then kind of learn over time, and some of the evidence we had of that kind of one-off intervention wasn't hugely impactful, and in some cases could actually then just start the conversation and then it's gone, and then people are like, we can't talk about that now, and actually makes people feel worse. And that's a really important thing. And now we're much more that if someone wants one of our speakers to come in or someone to share their story, that it's got to be part of an actual ongoing process of trying to make improvements. When it comes to tackling stigma and discrimination, you can't do it in an hour. You've got to actually work it. It's not easy, but it will definitely be worth it in the end.
Of course, because people just see it as a tick box. It's either a tick box and then it's just like, oh, that's had a speaker in, great, lovely. Oh, there we go, back to work. Let's all just go back to what we're doing. Or what you're actually doing is going in for an hour, creating massive hope for a lot of people and then going, but you're not getting this again, which that's horrific. So again, I completely agree with what you're saying. It has to be an ongoing. It has to be consistent. It might be that you do something over a year, once a month, and then people know it's coming and people know that they've got that time. And I guess what James and I are finding is people are saying, well, I know that I can tune in on Wednesday. That's my wee time.
It's something alternative, isn't it? On a Wednesday night, switch the telly off.
Exactly. Get the telly off and get us on.
And get the telly off, tune into something that's about mental health, and you might find something on here that, maybe you'll reach out to a certain charity or a certain group, like, CME, and, it's great that we have guys like yourself coming on and speaking about this, because for the viewers and then listeners that don't know, this is a platform to have it, and, hopefully, people can gain a lot out of it.
And I think we understand, and I think I've always understood this, that I am the person for everybody. You couldn't deal with that. You couldn't deal with the whole world. You just can't, right? So I guess it's like us bringing people like yourself. Again, people might not. I know a lot of mental health charities, organisations are doing fantastic work, but not a lot of people know about them, because all of your work goes into doing the work with the people. And it's not big advertising. You get advertising, but again, James and I just bringing organisations like yourself forward and there'll be loads of people that will know you, but loads of people will go, oh, that's really good, that I've never heard of them, this is great. So just bringing to the people the support, or at least some doors that could open as well.
Yeah, definitely. No, it's a great thing you're doing, and really good to chat to you as well. It's really interesting.
We're learning as we go along, mate. It's just one of those things, you know. Like we say, humour's great on here as well. And me and Brooke, we talk over each other quite a lot. Do you know what I mean? And we've got to apologise, but it is what it is, you know.
We're just so passionate. That's it.
Aye,
we're not rude.
passionate.
We're not rude. We're passionate.
But yeah, so what I was going to say, how's things been through COVID for you, and obviously for, you know, the volunteers at CME and everybody else? How have you been coping over there?
It's been mixed, I think. As a staff team, I think we found it pretty difficult. Trying to really still feel connected to everyone when you're not connected in the same ways. And some people really like the social environment of being in the office with people and being able to chat and actually just see people and hang out and talk, not just in a work capacity, but just to be with people. And I think that has been really difficult. I've personally found that really difficult. I do like being around people, and like my sarcasm doesn't work as well when it's like over a delayed Zoom call or if it's in an email. I like to actually, be cutting in person.
Yeah.
But it's no, it's like, so I think it's been difficult. It's also been super busy, particularly in the comms team, because we had a really busy start to the year before. We had Time to Talk Day at the beginning of the year, the last one. We then had a big national event in March, about a week or so before lockdown, and did loads of we were working with Gail Porter on some of the promotion and comms around where there's some stats that we were releasing. It was a really busy time for us, and then we were going to then take a bit sort of April to then take stock, look back at what we've done over the last 3 months, and then plan for the year. And then lockdown happened, COVID happened, and then being in communications, kind of everything changed. So everybody needed to know how everything had changed and what we were doing in place of everything that had changed. So then all of that all comes through communications, and it was just trying to keep on top of that and make sure that people knew how they could, for our volunteers, our partners, the sort of other organisations that we work with, people who just follow us on social media, our staff team as well, what's happening and what's changing and what are we going to do. So it was quite a big adaptation. It was quite difficult, quite busy for quite a long time. But it's also led to some real interesting ways of working, things we wouldn't have done before. We created something over the summer called the Anti-Stigma Summer Sessions, which was kind of not too dissimilar to this. We did Facebook Live videos every week, and or every couple of weeks. It depended when we had something. But it mixed up. We had a couple of our volunteers who were authors who had written books that had been published, so they shared sections of their books, and then I did little interviews with them and just asked them about their life stories and what had led to them writing things. We had another one with some of our champions who were talking about their favourite films and that had helped them think differently about their own mental health. So one of our volunteers, and so he was speaking about his diagnosis of schizophrenia and Watching a Beautiful Mind, so it's Russell Crowe, isn't it, who's in it. It really changed the way he actually thought about his own mental health. So they're all talking about that. We've had another similar one we've had a couple with art as well, and some artists who were going to actually have a sort of an actual show in a gallery, but it got cancelled, so we did it all digitally instead. We had one, got one tomorrow actually, called 6 Word Stories. It's 3 of our volunteers and one of my team members made, and they're looking at how they can tell their own story about their own mental health, their own journey in 6 words, and looking at 6 word stories and how you could tell a whole story in 6 words. So that should be a really good one. That's tomorrow at 7, I think. But we did all of these things, and some of them we kind of pre-recorded on Zoom if people weren't comfortable doing live, and then we used the platform to live stream it onto Facebook, so it appeared like it was live, and we just kind of pretended. So we've done loads of this stuff, and we've reached really good audiences for them. And I think one of the book readings, we had 5,000 people viewing it, not the whole time. Some people just scrolling by and saw it. But I think we had a solid 150, 200 people watching pretty much the whole 50-minute show.
Great.
And then we were kind of thinking, like, for social media, sometimes you do get big hits, sometimes they're lower. But if we were kind of comparing that to if we did a community book reading event, there's no way we're getting 150 people turning up for that and a few thousand others popping their head in for 10 minutes. Like, that's just never going to happen. But we never would have done that. But because of COVID, we've then had to think differently and work differently. And some of the stuff has been really good. Most of the good ideas have been other people's ideas, and I've just jumped on them and helped out. So, you know, it's good to be part of.
There's some amazing talent coming from CME.
Yeah, it's a lot of it. Like our social movement team, who work with all our volunteers, they're so creative, as are a lot of our youth workers and our youth champions as well, and basically all the people that are working with our volunteers and our volunteers themselves as well. Like, they come out, a lot of the ideas, like for the 6-word stories, for the films one, they're all from our volunteers, and they're just different ways, and it's great for them because they were ones that maybe everything that they were doing suddenly changed in March. Like, all of our youth champions were going into schools and training, and then they couldn't go into schools, and the schools weren't open.
I know.
So
I'm the same. I miss the schoolwork. Really miss the schoolwork.
I bet, especially if you enjoy it, and it's So, and then the champions coming up with stuff in their communities. Again, they couldn't do it, so they just then. It was kind of then figuring out what we can do, and some of them were like, you know, right now it's just not good, and a lot of people, we have seen a lot of people who are already struggling with their mental health. This has been a really difficult period that's made a lot of people's mental health worse, as well as a lot of people struggling for the first time. So for a lot of people, it was just they took a step back and they were like, well, not now, and that was cool. We just kind of checked in and saw how they were. But for others, we're still really like, I want to do something. What can I do? And they came up with some amazing ideas.
That's all about adapting your work, you know, especially through a time that right now, you know, unnecessary times. And thank God for social media. Thank God for, you know, Zoom and all that, you know. But yeah,
and it's brought out a lot of the creativity. As you say, a lot of people might not want to turn up for an hour, but they can pop their heads in for 10 minutes, and that might be all they need. And I think that's a great thing. Again, it's just giving people exposure. It's putting people in control as well, isn't it? Of being able to watch this stuff or interact with it from the comfort of your own home. Now, we don't want that forever. We want to go back to. We do want to go back to some. We want your dining room back in the office socialising. But it's definitely bringing out the creativity in us all, isn't it?
Yeah, and it will be good. But I think what we've got to make sure we do when we go back is when we can have physical events again, is to not forget what we've done and all the people who watched us digitally, and actually make sure that all of our events we're kind of considering how we're going to do it in a digital way as well, whether it's Facebook Live or it's a Zoom or whatever it may be. We're actually planning that in alongside, like, that's going to be for us going forward, as important as sorting out the catering. Whereas before it was, and even as a comms team, it was almost a bit of an afterthought. We'd get the comms team event sorted, we'd get people there, then we'd think about creating a hashtag. Will we live stream a bit? Will we film a bit? Will we do some little clips on social? Whereas now it's got to be right from the start, like, how can this event be as accessible and as enjoyable for someone who's sat in their living room as it is for someone who's sat in the auditorium or whatever it is where we've got it.
Absolutely. Because what about the people, as you say, people that can't leave the house, maybe for physical reasons, for mental reasons, for emotional reasons? I mean, do we just then exclude them when we move back to different times again? Of course not. So that's good that you guys are thinking ahead of that to almost include people who have supported you through this time, to keep them included as well, isn't it? And I think, although this has been a really challenging time for the world, I think there'll be a lot of good that will come out of this as well. Like, moving forward, people will be included from. So we are going to think about, like, how can we keep this going as well? So that's good.
Yeah. Nick, is there anywhere we can find you on for the viewers and the listeners out there for CME?
Loads of places. Obviously, my dining room. That's the main thing.
I love a chat at your back door.
Our website is cmescotland.org. You can find us on Facebook, Twitter, and Instagram, all at CME Scotland or /CME Scotland or whatever it might be. We're on LinkedIn as well. If you just search for See Me or See Me Scotland on LinkedIn. Our YouTube channel is See Me Scotland as well, which can lead to some confusion and all that, because our name is just See Me, but it's amazing how many places there is, so many things that could be See Me. So all of us on See Me Scotland, just because it's a bit easier to find. But yeah, if you look for See Me Scotland across social, on our website, you'll find us pretty visibly anywhere.
Nick, you're an absolute champion. Thank you for coming on and speaking about See Me and your experience, and really lifting the stigma with us at Let's Talk Mental Health. Thank you very much.
It's been great speaking with you.
Yeah, not a problem. Thank you for your time, and again, reach out, for the people that are going to watch. Make sure you reach out to See Me, and Nick's been very good with communications with myself. So if I'm sure that he would help you with anything that, if you get in contact with him. But listen, thank you for lifting the stigma with us, Nick. We have been Let's Talk Mental Health, and good night and God bless. Thank you.
Good night.
Thanks.
Let's Talk Mental Health podcast is sponsored by Torrance House Interiors, East Kilbride. Concept by you, designed and managed by us. Bespoke luxury kitchens, bathrooms and room interiors. Contact us at info@torrancehouseinteriors.com or phone 07400 600 556.